You are listening to the Haig MD channel. Nothing on this channel is medical advice. It is for information purposes only, and before you make any changes, or if you need advice, call your own doctor. Hello everybody, and welcome to the post-call edition of the Haig channel. I'm Dr. Melissa Haig. I'm a practicing OBGYN. I'm also a women's sexual health expert. So, like we start every episode, today's sexual health hint, yeast infections. If I had a dime for every time someone said they had a yeast infection that they did not, I would be a very wealthy woman. Alas, I do not get paid to tell people, no, you don't have a yeast infection. So the reason I want to bring this up is because all itching is not yeast. So if you have itching down there, don't assume you have a yeast infection, especially if you're postmenopausal or if you are a teenager, because those two populations, it's actually pretty rare. The most common cause of actual yeast infections, believe it or not, goes back to one of our other episodes, it's elevated blood sugar. So one of the first things I do if a woman is coming in and we're having issues with yeast is we screen for diabetes or pre-diabetes. And it's actually pretty common that that's their issue. But if you think you're itching, you really need to get it checked out. You need an expert to look at you because it could be lichen sclerosis, which is an autoimmune skin condition that causes thinning of the skin and little kind of tiny, what we call in medicine, fissures, what you can think of as like a paper cut. So burns like crazy when anything touches it, but then itches like crazy as it's healing. It could be cancer, frankly, depending on what age group you're in. It could be yeast, but less likely. Could be a sexually transmitted infection if you're dealing with discharge. But my point is, not everything that bothers you down there is yeast. And like all sexual health, it goes back to having good overall health, which is what the point of this channel is. So I wanted to start with pointing out that I'm post-call. So I got post-call don't care hair. I have very little makeup, and you're just gonna have to roll with it because my producer really needed to get another show in before she went on a trip. You know, we got to work with the help that we have. So several people have asked me just to talk a little bit about OBGYN life, so I'll do that. I delivered 2 or 3 babies last night. So in our group, the only way anyone can get a weekend off is if when you're covering, you cover like noon Friday to 5 p.m. Sunday. So that entire time, I'm taking call for myself and my 3 partners and sometimes lots of other people, just depending on what's going on. So did several deliveries last night, home around midnight. Lots of broken sleep all night. I got in 2 or 3 different admissions because of ladies that were bleeding or had a pregnancy on the wrong location or a fever. So sometimes OB related, sometimes not. Then got up early this morning to go and do an unscheduled surgery that came up, and then a delivery, and then I turned a baby, which is super fun, especially when it works. And now I have a couple other people in labor. So we're just kind of like shoehorning this episode in between all the other work. I don't plan on making this my life's work. I'm just really here because it's fun for me to talk to you and to dispel misinformation. And I just wanted to point people to a channel where, yes, I am an expert and we're going to talk about real medicine and data, but also just life. Like, life is hard sometimes. But what I want to cover today was brought up to me by a physician actually in the hallway at a surgery center. And, I was talking to him about this new project that we're doing. And he said, I'd really love for you to talk about what some people are calling chemical anorexia or drug-induced anorexia. And I couldn't think of a better time to talk about it than now, as this episode's going to air as people are going back to school, starting school again. And this is becoming a huge issue in the teen and young women population. Before I get into this, I just want to say I am not opposed to this class of medications. I've certainly used this class of medications in my patients for medical indications. I personally tried this class of medications, but just could not tolerate the side effects and really had to find a different plan for myself. But what I'm talking about are the GLPs, the semaglutide, the weight loss shot that a lot of women are picking up at their local spa as opposed to being prescribed by a physician. The actual indication, the reason this medication was designed was for diabetics, for people that were really struggling to keep their blood sugars in a good range, their hemoglobin A1C, that's the blood test you can get that kind of gives you an estimate of the last 3 months of what we call glycosylated red blood cells, or how much sugar's on your blood cells. So it kind of gives you a bigger, broad picture of your metabolic health. These medications were designed to get those numbers into a better range, to reduce the long-term complications that our diabetics have sometimes. Now, what's happened over time, and if you have not lived under a rock, you have totally seen this, is celebrities are using it who are clearly not overweight or obese. Whether or not they're diabetic, of course, I don't know, but it has really gained traction, and now it is what I would call one of the #1 abused drugs, legal drug, but drugs among the population that we're seeing. The big issue that I wanted to broach with you all today is this is happening in our teen population. So girls are under, and some boys too, but primarily the girls is where I see it, of course, that's all I see, are under this huge pressure to be thin. And they come at this from a place of poor image of what women should look like. I mean, good God, TikTok makes it look like if you are not a stick figure with no fat in your face and your clothes aren't just falling off of you because you're so thin, you are not the ideal woman. Let me just tell you that that's not real life for most women, and also not healthy. The big problem that we're seeing is girls are using this weight loss shot to lose a tremendous amount of weight. It's causing anorexia. So they're not giving their bodies the proper nutrition that they need, especially at that point in their life. The young adolescent and young woman is at a critical time in her life for things like bone development. If there is malnutrition during that time, what happens over time in my world is they get thin. The brain tells the ovaries, hold up, y'all. We can't be getting pregnant right now. We are completely unhealthy. There's no way we could sustain a human life. And it shuts down what we call the hypopituitary ovarian axis. So that's what's responsible for menstruation in women. It shuts it down. It's like, we can't do this anymore. So not only will these women not ovulate, which, by the way, this is not the way to go about avoiding pregnancy. Not only will they not ovulate, they also won't make the hormones that they need for bone development. So these girls are taking these medications to the point that they aren't having periods anymore. Their ovaries aren't making estrogen. Their bones are no longer getting the support they need. And they can develop brittle bone disease as an adolescent, or at the very least set themselves up for a lifetime of struggle with osteoporosis or osteopenia. If they develop osteoporosis or osteopenia in their lifetime, of course now we have a whole new set of problems. And that is not even to say how many mental and emotional issues are coming along with this. So what's the advantage of semaglutide for like a diabetic or a morbidly obese patient that we're really trying to get them on a fast track to metabolic health? Well, the patients that have been successful with it have told me it just like shuts the chatter off in their brain. And that can be amazing, especially for the woman like me who's really struggled with an eating disorder or disordered eating, where thinking about food all day is a huge problem. It can kind of cut that for them. But the problem with a young, healthy adolescent woman who is taking these medications, who doesn't need the metabolic health, who isn't overweight, is it also shuts down her appetite, shuts down the food chatter, and those normal, healthy desires to eat go away. If you've ever been around a teenager who has a healthy appetite and a healthy way of looking at food, what you'll notice, or what I certainly noticed with my own kids and other girls I've been around, is, they may not eat breakfast. And then they get up at 10 or 11 on the weekend, and then lunch comes around and they're not that hungry, so they don't eat a whole lot. But then, dinner, look out. She might eat the whole pizza. You may not even get any dinner because she's really hungry. And that's kind of a normal, natural way for the appetite to work. They may not be hungry sometimes. I came home after a hard day at work and I say to my daughter, hey, what should we have for dinner? And she's like, I'm not really hungry. I had a big lunch. So it's normal to have those surges in appetite and then the lesser appetite. And when you completely alter that with an injection and you no longer feel hunger, what happens is anorexia. So these young women, young girls are going days, weeks without adequate nutrition, and it is destroying their bodies. The brain and the ovaries lose that connection. And again, I see girls all the time in the office for what we call amenorrhea, or no longer having periods. And it can happen for a lot of different reasons. I'm not saying this is the only reason that girls don't have cycles, but the first thing we do is try to restore that natural cycle. And if, at the very least, if they have a condition where their estrogen has gone down, let's say they're going through chemotherapy for some sort of cancer, we want to support their bones with adequate estrogen production while the ovaries are being shut down by that medication. So there's lots of things that we can do to help these girls, but step number one is getting them off of the injections. So how can you tell if your daughter is using these medications? Because man, they're getting it from places that are not legit, okay? I am not having teenage girls come in my office and leave with a prescription for these medications. They're actually becoming available on the street, which is weird, right? Like PCP or semaglutide, what can I get you today? How you can tell is just like all the other things that we watch for with anorexia. You never see her eat. You sit down at a restaurant, she'll order something, and instead of actually putting food in her mouth, she strategically moves it around on the plate to make sure it looks like food is missing, even though it's not. I have seen girls kind of scoot their food off their plate and hide it in their napkin. They're avoiding eating at all costs. Now, what do you do to help them? Honestly, I would take them for professional help. I am not someone that can help a woman or a young girl deal with the emotional and mental aspect of the anorexia. Now, while she's being treated for that, while she's working with a counselor, a psychiatrist, therapy, I certainly help support her bone development and other things with medications. And you should see a gynecologist if your daughter stops having periods. But the emotional impact of it, absolutely, you need an expert to help with that. Now, if you are experiencing anorexia or disordered eating, I highly encourage you to seek professional help as well. When we talk about fasting on this channel, we're not talking about anorexia. Those are two completely different things. And there are a lot of experts that talk about the difference. I'm not going to go into a whole lot in this episode, except to say, I encourage women who are doing intermittent fasting to not ignore their bodies and to make sure that they're metabolically healthy. You see a physician first, you understand what your numbers look like, and then you're being very strategic about timing your nutrition. You're not making sure your body has no nutrition. You are just timing it so that there are periods of time that your pancreas gets a rest before you have your next nutritional opportunity. If you're doing true therapeutic fasting for days on end, things like that, that is done under the guidance of a professional. That's not what we're talking about here. For adolescents, I don't recommend intentional fasting. I do recommend they stop snacking. So in that sense, you can call that time-restricted eating or just natural fasting that happens when we're not constantly eating. But what we don't recommend is days on end with no nutrition. And often these girls won't even really be drinking a lot of fluids. And that's typically how they have their first encounter with the medical community, is they get to the point that they are so dehydrated that they pass out at school, or they're involved in some sort of activity where they can't tolerate it and they pass out at that activity. And that's the intersection with the medical community. To the physicians that watch this, be on the lookout for this. If you suspect that you have a person that is abusing the semaglutide or utilizing it to attain a certain body habitus, I would just confront it and talk about it. Talk about the dangers of not eating for days on end, especially in this younger population that is in this rapid growth phase of life. So I wanted to put this in front of you, have you thinking about it. And again, our goal is to love the people in front of us, have compassion for them. And you have to see this as kind of any other disordered eating or any other problem that we have created as a society, because we have told young girls, young women how they have to look to be acceptable, to be popular, to be who they should be in society's views. And we got to break that. Moms, we got to be careful about how we talk about our bodies. We have to be careful about framing the conversation not around I'm fat, I'm ugly, I've got to lose weight, but more so around I want to be healthy and I want to be in this for the long run, to be there for you and your dad and my other family members. So as you are struggling maybe with your own self-image and your own conversation with yourself around health, be cognizant of that. It's cognizant of that, especially if you have young girls. You know, they often model and mirror back to us what we are saying about our bodies. And I have not been thin since I was in utero, I'm pretty sure. I've been overweight my whole life. But I've really tried hard to have my daughters see me not putting down my body, but talking about it in a way, you know, I'm exercising today because I want to be healthy. I want to be there for you guys. I'm not eating this at lunch today. I'm eating this because I'm trying to make different choices that I think will set me up for health. Not, oh, I'm fat, I'm not having pizza. Or I can't eat that like you can because, you know, when you get to my age, you just get fat. We have to be very careful how we talk about things, because I want my daughters to grow up strong and secure in who they are, wanting to be healthy, wanting to make good choices with their lifestyle, but not because they think they are bad or ugly or unacceptable if they do not. So, I wanted to bring up, this is completely unrelated, but I'm post-call, so I've got lots of things floating around in my head. I really appreciate everyone that's given me feedback on the channel. You know, we're new to this. It's a low budget operation. We're working on the sound quality, but you know, I gotta wait for it to be delivered. And again, my producer needed another video. So as we kind of wrap this up, I want you to just look at the young people in your life and really look at them, look at their face, look at how they're eating, what they're doing, have compassion on them, remind them constantly, you are amazing, you look great. If you see them engaging in unhealthy behaviors, take it head on. Say, hey man, I saw at dinner last night, you didn't eat anything. Tell me what's going on. Or I've noticed you're exercising 2 hours a day. Why are you doing that? Or you notice that his or her friends are all very, very thin, if they're gaunt, if they have the dark circles under their eyes. I mean, just like you would watch out for any other kind of drug or alcohol use in the young people around you, this is the next one they have to pay attention to. And always affirming our kids, just saying, man, I'm so proud of you, you're doing great. But also, we can't let them engage in unhealthy behavior without talking to them about it. Oftentimes parents are so afraid to say something that they say nothing. Don't be that parent. Just say, hey, I'm really concerned about you. I want you to be healthy. And make sure that they have access to professional help, that you engage with them. So before we wrap this up, again, I'm post-call, so if it's been a little bit of, oh, look, a squirrel, that's just kind of how I'm going to be today till I get some time to sleep. I wanted to just bring up one little thing. This is not really a health thing, but there's been this new trend in medical communities to survey everyone. A lot of my colleagues are hospital employed, and their pay sometimes or their bonus structure is based on these surveys. Now, here's my disclaimer. I don't read surveys. I really try hard to stay away from them. If I happen to read one here or there, it's because my staff is like, oh, you really should see this. Because I'm an arrogant surgeon. I don't need to read positive surveys. It just stokes my pride, which I'm always trying to keep under control. And at the same time, the negative ones are often not that helpful. It's like, I mean, I got a 1-star review one time, and it was this whole glowing paragraph about how great I was, but there was no coffee in the waiting room, and the patient had to wait too long. Well, okay, that's ridiculous, right? So as you are getting surveys for the doctors you're seeing, keep in mind, she may have been up all night delivering babies, and she's doing the best she can to address every patient. Or the room next to you, he might have told someone, I'm sorry, but you're pregnant with a child that's not going to live. Or she might have been in surgery all morning, and yeah, she's an hour behind in the office. She's doing the best she can to keep up. You always have the option of rescheduling. So just keep in mind, that's the pressure of the doctor, is we're doing the best we can with the patient in front of us, and we have all these other outside things going on. So just like I try very hard to have compassion for every patient in front of me, and I totally fail sometimes. I'm far from perfect. I have absolutely had to go back and apologize to somebody before because I wasn't perfect. But you try, we try. Keep in mind, those surveys can be tied to something way bigger than just that doctor. And if you're upset about something that's really not in the doctor's control, don't punish them with that survey. And physicians, don't read the stupid things. It is not the definition of your worth. You are doing the best you can, and reading those oftentimes is not going to make you a better doctor. So I would just flush them down the toilet. That's my humble professional opinion as someone who doesn't employ other doctors. Well, it's been a great time. I'm now going to try to maybe take a nap, maybe drink some more coffee. I don't know. I'll figure it out. But as I end every episode, love out loud and live on purpose. See you next time.